Paranoia, meaning, causes, symptoms, and treatment. Welcome to the Ultimate Wellbeing. Ultimate Wellbeing is a health and well-being channel. The Ultimate Wellbeing channel will help to improve your health and well-being. On this channel, you will see videos promoting good health and well-being that will assist you to improve your health and well-being to ensure your ultimate well-being. If you are new here, make sure to subscribe to our channel to get a regular dose of good health and well-being tips to become a better you for ultimate well-being. Relax, have fun as you see our videos and become a better you for your total well-being. Thank you. Paranoia, meaning, causes, symptoms, and treatment are discussed in this video. Now, let us start. What is paranoia? Paranoia is the irrational and persistent feeling that people are out to get you or that you are the subject of persistent, intrusive attention by others. This unfounded mistrust of others can make it difficult for a person with paranoia to function socially or have close relationships. Paranoia may be a symptom of some conditions, including paranoid personality disorder, delusional, paranoid disorder and schizophrenia. The cause of paranoia is unknown, but genetics are thought to play a role. Treatment depends on the condition diagnosed as its cause and may include treatment by psychological therapy or medication. Symptoms of paranoia. Paranoid symptoms may range from mild to severe. They depend on the cause but, generally, a person who is paranoid may be easily offended, find it difficult to trust others, not cope with any type of criticism, assign harmful meanings to other people's remarks, be always on the defensive, be hostile, aggressive, and argumentative, not be able to compromise, find it difficult, if not impossible, to forgive and forget, assume that people are talking ill of them behind their back, be overly suspicious, for example, think that other people are lying or scheming to cheat them, not be able to confide in anyone, find relationships difficult, consider the world to be a place of constant threat, feel persecuted by the world at large, and believe in unfounded conspiracy theories. Types of paranoia. Paranoia is associated with three principal conditions. 1. Paranoid personality disorder, considered the mildest type. Most people with paranoid personality disorder function well despite their mistrust of the world. The attitudes and behaviors associated with this disorder, when they become obvious, are often discovered to have been present for much of the person's life. 2. Delusional, paranoid disorder, characterized by the dominance of one delusion, false belief, without any other sign of mental illness. The person's behavior depends on which delusion they have. For example, a person who has a delusion of persecution believes that people are spying on them or plotting to harm them in some way. Stalking can be the result of delusional, paranoid disorder. For example, the person believes they are in a relationship with a movie star they have never met. In another case, a person may imagine they have a terrible illness, despite repeated reassurance from doctors. 3. Paranoid schizophrenia, considered the most severe type. It is characterized by strange delusions, such as believing that one's thoughts are being broadcast over the radio. Hallucinations, especially bizarre ones, are also common to the condition. A person with paranoid schizophrenia often finds the world confusing and functions poorly without treatment. Causes of paranoia. The causes of paranoia are unclear and depend on the condition with which it is associated. Theories include 1. Genes. Research is scanty and inconclusive. Some studies suggest a genetic link while others do not. It is also unclear whether genetic predisposition to paranoia, if it exists, is inherited or not. 2. Brain chemistry. Brain chemicals, neurotransmitters, form the basis of thoughts and feelings. Certain drugs such as cocaine, marijuana and amphetamines alter brain chemistry and can bring on paranoid thoughts, feelings, and behaviors. This leads some researchers to believe that paranoia may be a biochemical disorder of the brain. The causes of this possible disorder are unknown. 3. Traumatic life events, for example, abuse in childhood may distort the way a person thinks and feels throughout life. 4. Stress reaction. Some studies have found that paranoia is more common in people who have experienced severe and ongoing stress, for example, prisoners of war. How stress can trigger paranoia is unclear. 5. A combination of factors. It may be that some genetic and environmental factors work together to cause paranoia. Diagnosis of paranoia. The condition causing paranoia can be difficult to diagnose because an exaggerated sense of mistrust is common to a range of mental disorders and occurs in some people with dementia. Another difficulty is that a person who has paranoia may avoid doctors, hospitals, and other medical settings for fear of being harmed. Diagnosis may include medical history, physical examination, assessment of symptoms, psychological tests, and tests to rule out other psychiatric disorders that may be causing the symptoms. Treatment of paranoia. While there is no absolute cure for the conditions that cause paranoia, treatment can help the person cope with their symptoms and live a happier, more productive life. Treatment depends on the type and severity of the condition but may include 1. Medications. Anti-anxiety drugs or antipsychotic drugs can ease some of the symptoms. However, a person with paranoia may often refuse to take medication because they are afraid it will harm them. 2. Therapy. This can help the person to cope with their symptoms and improve their ability to function. However, a person with paranoia is unlikely to talk openly and freely to a therapist, so progress can be extremely slow. 3. Coping skills. Other treatments aim to improve the person's ability to function socially. Options may include relaxation therapy, techniques to reduce anxiety, and behavior modification. 4. Hospital admission. In severe cases, the person may need to stay in hospital until the condition causing paranoia stabilizes. Conclusion. Paranoia, meaning, causes, symptoms, and treatment have been discussed in this video. Paranoia is the irrational and persistent feeling that people are out to get you. The three main types of paranoia include paranoid personality disorder, delusional, formerly paranoid, disorder and paranoid schizophrenia. Treatment aims to reduce paranoia and other symptoms and improve the person's ability to function. Hope this video is useful and beneficial to you. We love to hear from you. Please post your comment below in the comments section. If you are new here, make sure to subscribe to our channel and press the notification button so you can get a regular dose of good health and well-being tips to become a better you for your ultimate well-being. If this video has been helpful and beneficial to you, then, give it a thumbs up, share it with your friends and leave a comment below. Kindly note that any information on this video is provided for educational purposes only. Diagnosis and treatment decisions should be made in consultation with your doctor. Thank you. Thank you for seeing the Ultimate Wellbeing videos.